We're going into the COVID unit. Yeah.
Critical care workers at BC's biggest hospital brace for the patients they know are coming even before they arrive. Once a routine task, donning medical gear is now anything but simple, wearing it like being underwater.
It's a little bit surreal, to be honest with you. It feels like you're scuba diving almost.
It's a comparison Dr. Donald Grisdale never thought he'd make.
You're wearing your visor, you're wearing your face mask, your respirator, your gowns and your gloves. It just feels a little bit surreal because you literally have that barrier between you and the outside world. He's
an ICU physician at Vancouver General Hospital, where the front lines are divided in two: the hot zone and the warm zone. The hot zone is where the infected patients themselves are examined and treated. The warm zone is a buffer space that acts as a staging zone for medical workers. Each team spends 3 hours making the rounds inside the hot zone before peeling off all their personal protective equipment, washing their hands like lives depend on it, and then rotating out.
When the nurses come out of the hot zone into the warm zone, they're usually drenched in sweat. You can see their mask that's outlined on their face. And so when one team comes out into the warm zone, another team of nurses goes in.
You wipe down your mask.
They set up a really good two-way communication system so that we're able to easily communicate with the staff that's inside the hot zone.
The warm zone is also where the whole team of physicians, nurses, respiratory therapists, dietitians, and even pharmacists convene and communicate. They discuss the issues for each patient and come up with individual care plans for the day.
And 2 days of shortness of breath, fever, called the 911.
Nurses are the main point of contact for patients. There's an underlying uncertainty on both sides that's hard to describe. Mostly it's fear of the unknown. In a word, scary, says ER nurse Jess Donald.
They're scared when they come in, right? They're scared of getting a breathing tube put in. They're scared of what's going to happen. And we're scared for them, to be honest.
Her biggest daily struggle is finding human interaction in a unit that's defined by isolation.
It's just not being able to have their family come visit. We've been trying to get around that with FaceTiming and other ways of using technology to really connect them with their families. But I think the biggest theme that we get from them is the isolation.
One particular case stands out for Dr. Grisdale. He recalls treating a young woman who'd grown seriously ill with coronavirus.
It was really hard because every day I would phone her husband, who's at home sick himself with his kids, and having to say, well, your wife's not doing well or she's getting worse. And I just sort of put myself in that position, like what would it be like if that was my wife in there? And it was really, I found it emotionally quite difficult.
So how do they cope with the pressure, the weight of a global pandemic on their shoulders day after day? Well, the support from the community is what keeps them going.
Feeding the front lines has been so great with sending us food, making masks for us. It's that kindness, I think, that's really permeates through when we're feeling so isolated and we're not alone, that, there's this whole we're in this together movement, and I really feel that.
And for all the thanks, a thank you in return.
It's thankful to the social distancing and people, all the sacrifices that people have made that have allowed us to really deal with all the patients that have come with us. So yes, we see it on the front lines, absolutely, but I certainly understand the personal sacrifices that the public is making as well.
The gratitude goes on display at precisely 7 p.m. every day.
Keep cheering for us at 7 p.m. It really gives us life. It brings tears to my eyes every time I come out.
Yes, it's been really heartening. It's certainly been the most fulfilling time in my career, bar none.
And tucked away on a wall in their ICU, this reminder that what's audible outside is felt inside every minute of every day. Tanya Fletcher, CBC News, Vancouver.